Well, Konrad Reinhart is president of the Global Sepsis Alliance. It's a non-profit charity organization based in Berlin. Konrad, thank you for your time. Everybody is getting extremely worried about, obviously, what's happening with the coronavirus. We have 17 deaths. Every year, thousands of people die from influenza. And here, we have a disease that kills more people than cancer. Is it preventable?
Yeah, in part, indeed, it's preventable. And the fact that the numbers are much higher than it was reported before was that we had only data on the incidence of sepsis from high-income countries, whereas it's well known that the death from infections is much higher in low and middle-income countries. And it's preventable by high-quality healthcare systems. And that's why poverty in general is the most common cause of death for it, because it means no access to high-quality healthcare. It means no access to preventive measures like vaccination against influenza, pneumococcal, etc. It means no clean water. It often means poor sanitation. And so that's the reason for this discrepancy. However, as you mentioned, also in the high-income countries, the incidence is around 500 population per 100,000 population. So it's not that far different from the average incidence of sepsis on a global level.
Konrad, just explain to us, because obviously we're not the experts that you are, how you might contract sepsis. Would you have to already have suffered some kind of injury for your blood to get infected? How exactly does the transmission and the reception of the disease enter the human body?
Yeah, by definition, sepsis only occurs when you have an infection. And like the coronavirus or Ebola, but also common infections like pneumonia, appendicitis, may lead to sepsis. And not only wound infections, but, as I said, every infection, if the immune system of the body is not able to contain it locally, may progress to sepsis.
Yeah, when you talk about the quality of healthcare being the most critical thing in terms of surviving sepsis, it makes it sound very much like Ebola. I believe that nobody needs to die from Ebola if they get the treatment, the correct treatment at the right time. And the evidence may be that most of the people who have died from Ebola have been living in lesser developed countries. So is the challenge in terms of eradicating sepsis one of finance, and where should the finance therefore come from?
It must be addressed within every healthcare system around the globe and must have a high priority, as it was set out by the resolution of the WHO on sepsis. And as it is, as you mentioned, as common as cancer, the same amounts of money have to be addressed in this area. And this means also access to intensive care units, because sepsis is by definition an infection which has caused an organ dysfunction. And organ dysfunctions like kidney failure, like heart failure, etc., etc. So it requires cheap but often not available therapies like treating with antimicrobials and removing the source of infection, sometimes abscesses, sometimes infected foreign bodies in the body, and also giving fluid.
Okay. Konrad, we really appreciate you educating us on a disease that kills, unbelievably, 11 million people every year, at least it has over the past 3 years. That's Konrad Reinhart speaking to us from Berlin.